Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Buergers disease. So Buergers disease is also known as the thromboangiitis obliterans, and the pathophysiology is there is a thrombosis. There's thrombosis followed by the angiitis, and it also leads to the permanent vessel occlusion. Next is there is inflammatory. Inflammatory. It is the involvement, and this is nothing but of the arteries and also the veins and the nerves. Now the vessel involvement, it includes the small as well as the medium sized vessels, and also it includes the skip lesions. So disease progression is from a distal to the proximal. The prevalence, it is exclusively seen in the young males, so young males, and also in case of smokers and in those less than 40 years of age. Now what is the clinical triad? The clinical triad, it includes the RIM, that is R for the Raynaud's phenomenon. Next is I for the intermittent claudication. Then comes M for the medial superficial thrombophlebitis. Next is diagnosis. Diagnosis, it includes the forelimb angiography and also the corkscrew. So forelimb angiography as a corkscrew collaterals, and also the ankle brachial index. So these are the diagnoses. Then if you look at the histopathology, it can be a sharp segmental acute, segmental, and it can be acute, sharp segmental acute, and the chronic vasculitis. And this is nothing but of the small and the medium vessels with the thrombosis of the lumen, which may be undergo due to the organization and the recanalization. The thrombus contains the microabscess, and the inflammatory process, it extends to involve the neighboring veins and the nerves. So with time, all these structures, three structures as artery, vein and nerve, they become encased in the fibrous tissue. So after it's encased in the fibrous tissue, the ABI interpretation, let's look into its ABI interpretation. It is the ankle brachial index. So it can be 0 to 1 to 0.4. 0.1 to 0.4, it means the critical limb ischemia. Next is 0.5 to 0.9. It means it is intermittent claudication. Then comes 1 to 1.2. It means that it is normal. Next is greater than the 1.2. Greater than 1.2 means it is claudication, and it is seen in patients with calcified vessels in case of the diabetes mellitus or the ESRD. Next we look at the Boyd's classification. So Boyd's classification is nothing but it is the intermittent classification. It is divided into 4 grades, that is 1, 2, 3, 4. So 1 means it is a pain, it appears on the start of walk, and but it disappears if the patient continues to walk. Now let's looking at grade 2. Grade 2 is where the patient can walk with pain. So you walk with the pain. Then comes the grade 3. Grade 3 is the pain, it compels the patient to take rest. So you end up taking rest. And then grade 4 is where there is a rest pain. Now how to treat this condition? Treatment is by abstinence from smoking, the vasodilators, there is the lumbar sympathectomy. Next comes the omental transposition, there is amputation, as well as the surgical bypass. Next is there is the surgical bypass or cannularization, and this is rarely feasible in Buergers disease because the occlusion of small veins and because of the occlusion of the small and medium vessels and the presence of the segmental or skip lesions, as well as the absence of the distal target vessels and the bypass. To learn and grow daily like this, please do subscribe. you.